You're watching KPVI News 6, your news source for East Idaho.
All this week, we're taking a look at some of Eastern Idaho's toughest jobs. Today, we are scrubbing in on an open heart surgery with Dr. Jacob DeLaRosa at Portneuf Medical Center. Now, by way of disclaimers, there is surgery footage in this story and a lot of it. So those of you who may be sensitive, take note. Also, the patient in this case granted permission for us to talk to him and also to videotape his surgery. Dr. DeLaRosa grew up in Los Angeles as the son of a physician. He is board certified thoracic and general surgeon. He's written a book called The Heart Surgery Game Plan, and he says it's always been his dream to be doing what he's doing now.
We're going to do bypass surgery. And
Dr. Jacob DeLaRosa already knows what he's going to do when he goes into surgery, but he doesn't always know how it will turn out.
that's something that a lot of people don't understand, is that everything could be going perfectly routine, and then at one moment it's changing. You got to be on your A game every day.
Meanwhile, the day's patient, Roger Sheremy from Soda Springs, is ready for surgery. He feels confident in having his triple bypass, but he knows there are risks.
Told me I could die, you know, and he also mentioned that I could have a stroke. I've already had the stroke.
Dr. DeLaRosa says he's never been one to sugarcoat a patient's condition. That may seem harsh at times, but he also readily gives out his cell phone number to his patients so that he is available whenever people need him.
As patients will tell you, they can always reach me 24/7, and the key of being able to reach me is that my phone is always on.
The doctor's never-ending availability and his ability to connect with patients and instill confidence is what has calmed Roger and helped him feel more comfortable.
I think life is too serious most of the time, so I need to joke a bit about it, and he is open for a good joke.
I feel like I've been granted a gift, and I have a gift, and it's one of those things I want to share it.
In this surgery, physician's assistant Steve Zerlinden removes a blood vessel from Roger's leg while Dr. DeLaRosa cuts into Roger's chest to expose the heart. The heart team will use the vessel from the leg to bypass 3 vessels on the heart that are blocked because of heart disease. Before they can do that, the team gets Roger's blood working through the bypass machine to keep his body getting oxygen. The operation can be done with a beating heart, but today they stop Roger's heart. Then, with a new vantage point, we get to see the intricacy of Dr. DeLaRosa's work. Here, he's sewing 2 vessels together. One of them is about the size of a buttonhole. Obviously, the margin for error here is tiny. Dr. DeLaRosa says the attention to detail needed here is one of the most challenging parts of his job. Then he releases some blood flow to check his work, and the blood is now flowing where it needs to. With all of the grafts in place, Dr. DeLaRosa shocks the heart.
Okay, ready? Go, shot.
To get it beating again. He finishes his work, gets Roger off the bypass machine, and closes him up. The surgery is done without complications, and with the team and the technology in place, it took about 3 hours. Dr. DeLaRosa thrives in this environment. It's clear that while this is a tough job with life and death consequences, he wouldn't want it any different.
You know, this is what I do, and this is what I enjoy doing. So if I wasn't doing it, it's more stressful than when I am doing it.
So our patient from this morning is recovering nicely in the ICU. He'll be there a day or two and then in the hospital for a few days more before going home. As for what it takes to become a world-class heart surgeon, Dr. DeLaRosa was in training for 11 years after graduating from med school, so that is 19 years of post-high school education.